Quetiapine fumarate, also known as an anti-psychotic drug, is used to treat certain mental and mood conditions such as schizophrenia, bipolar disorder, and sudden episodes of mania or depression associated with bipolar disorder. It works by helping to restore the balance of certain natural substances in the brain, which can decrease hallucinations and improve concentration. It also helps to think more clearly and positively, feel less nervous, and take a more active part in everyday life. Moreover, it may improve mood, sleep, appetite, and energy level, and help prevent severe mood swings or decrease how often mood swings occur. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Before you start taking Quetiapine fumarate, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 or 3 times daily with or without food. For the treatment of depression associated with bipolar disorder, take this medication by mouth as directed by your doctor, usually once daily at bedtime. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Take this medication regularly to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Keep taking this medication even if you feel well, and do not stop taking it without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Report any new or worsening symptoms right away and tell your doctor if your condition lasts or gets worse. Some common side effects of Quetiapine fumarate include constipation, drowsiness, upset stomach, tiredness, weight gain, blurred vision, or dry mouth. Dizziness or lightheadedness may also occur, especially when first starting or increasing the dose, which could increase the risk of falling. It's important to remember that this medication has been prescribed because the benefit to the patient is greater than the risk of side effects. Serious side effects may include constipation with abdominal pain, nausea/vomiting, restlessness/constant need to move, tremors, mental/mood changes, difficulty swallowing, loss of appetite, yellowing eyes/skin, interrupted breathing during sleep, trouble urinating, fainting, seizure, severe dizziness, or symptoms of high blood sugar. Additionally, quetiapine may rarely cause tardive dyskinesia, a condition that may be permanent, or neuroleptic malignant syndrome. It may also increase prolactin in the body, resulting in unwanted breast milk, missed/stopped periods, or difficulty becoming pregnant for females, and decreased sexual ability, inability to produce sperm, or enlarged breasts for males. In rare cases, males may experience a painful or prolonged erection lasting 4 or more hours. If you notice any symptoms of a serious allergic reaction, seek medical help right away. If you experience any other effects not listed, contact your doctor or pharmacist. When using Quetiapine fumarate, older adults with dementia may have a slightly increased risk of serious, possibly fatal side effects. It's important to discuss the risks and benefits of this medication with the doctor, especially for the treatment of dementia-related behavior problems. Quetiapine is primarily used to treat certain mental/mood disorders such as schizophrenia, bipolar disorder, and sudden episodes of mania or depression associated with bipolar disorder. It can also help prevent suicidal thoughts/attempts and provide other important benefits. However, it's crucial to talk to the doctor about the risks and benefits of using this medication, especially for people younger than 25, as there is a possibility of worsening depression, other mental/mood symptoms, or suicidal thoughts/attempts. If you or someone you know is taking quetiapine and notice worsening depression/other psychiatric conditions, unusual behavior changes, or other mental/mood changes, it's important to tell the doctor right away. This is especially important when starting a new drug to treat depression or when the dose is changed. It's also worth noting that this medication is not approved for use in children under 10 years old. Always follow the doctor's recommendations and take the medication as prescribed. Before taking quetiapine, make sure to inform your doctor or pharmacist about any allergies you may have. It's also important to let them know about your medical history, especially if you have a history of certain conditions such as eye cataracts, liver disease, low white blood cell count, seizure disorder, trouble swallowing, thyroid problems, or heart disease. Be aware that quetiapine may cause dizziness, drowsiness, or blurred vision. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you know how this medication affects you. Avoid alcoholic beverages and be cautious if using marijuana. This medication may also affect the heart rhythm, which can cause serious symptoms that require immediate medical attention. The risk of this may be increased if you have certain medical conditions or are taking other drugs that can also affect the heart rhythm. Additionally, low levels of potassium or magnesium in the blood may increase the risk of certain side effects, so it's important to discuss this with your doctor. Quetiapine may also make you more susceptible to heat stroke, so it's important to avoid overheating and stay hydrated, especially in hot weather. Before undergoing surgery, inform your doctor about all the medications and products you are using. If you are pregnant or planning to become pregnant, discuss the risks and benefits of using this medication with your doctor. It's important to not stop taking this medication without consulting your doctor, especially if you have untreated mental or mood problems. Finally, if you are breastfeeding, consult your doctor before continuing to nurse while taking this medication. Keep an eye out for any potential side effects in your baby and inform your doctor if you notice anything unusual. It's important to be aware of potential drug interactions with quetiapine fumarate. Make sure to keep a list of all the medications you are taking and share it with your doctor and pharmacist. Some medications, such as amiodarone and moxifloxacin, may affect the heart rhythm when taken with quetiapine. Other drugs, like itraconazole and phenytoin, can affect how quetiapine is removed from your body, which may impact its effectiveness. It's also important to inform your doctor or pharmacist if you are taking any other products that may cause drowsiness, as quetiapine may also cause drowsiness. Additionally, be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Lastly, quetiapine fumarate may interfere with certain lab tests, so it's crucial to inform lab personnel and all your doctors that you are taking this medication. If someone takes too much quetiapine fumarate and experiences severe symptoms like passing out or difficulty breathing, they should call 911 or a poison control center immediately. U.S. residents can contact their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness and loss of consciousness. It's important to seek medical help right away if someone has taken too much of this medication. It's important to keep in mind that you should not share this medication with others. Before starting this medication and while you are taking it, you may need to undergo lab and/or medical tests such as blood sugar, blood pressure, cholesterol levels, eye exams, weight, and blood counts. Make sure to keep all of your medical and lab appointments. If you need more details, consult your doctor. This medication is used to treat certain mental/mood conditions such as bipolar disorder, schizophrenia, and depression. It can help improve your concentration, mood, and decrease hallucinations. The daily dosage and the optimal timing for taking this medication will be determined by your doctor based on your medical condition and response to treatment. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose as scheduled. Don't take 2 doses at once to make up for the missed one. Make sure to store quetiapine fumarate at room temperature, away from light and moisture. Do not store it in the bathroom and keep it out of reach of children and pets. It's important not to flush this medication down the toilet or pour it into a drain unless instructed to do so. When it is expired or you no longer need it, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. Remember to take quetiapine fumarate exactly as prescribed by your doctor. It is usually taken once daily in the evening, with or without food. The dosage will be based on your medical condition, response to treatment, and other medications you may be taking. Be sure to follow your doctor's instructions carefully, and if you have any questions, don't hesitate to ask. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.